Okay, excellent. Thank you very much. It's a pleasure, an honour to be the last of the research speakers. I hope you've enjoyed today as much as I have so far. So, as you say, I'm Tierney and I've worked with Stephen May on this research project a few years ago about CPD, or continuing professional development. So, obviously, I think probably all of you will be of the same opinion that CPD is incredibly important, and we know that for our technical skills and knowledge for our veterinary surgeons as well as our registered veterinary nurses. But really what we wanted to look into a little bit more was this idea of non-technical competencies CPD. So you may love or not love the term non-technical competencies or any of the other terms that are used to describe these things. This is the one that we're going to go with. Just to give you an illustration of what I mean, these are some general examples that I've picked up from some of my previous research and also that I thought were relevant to today. So these are the kind of things we're talking about. And what research in the human medicine and veterinary medicine field is showing us is that if you do have these really good non-technical competency skills, then there are many different benefits for you as a vet and also for the other stakeholders around you as well. So the Certificate of Advanced Veterinary Practice, or the Cert AVP, may be very familiar to some of you. Maybe you've done it, maybe you were involved with developing it. It was developed by the RCVS. And back when it was originally started, at least, it consisted of a selection of clinical modules that you would choose, soft tissue surgery, for example, and one compulsory professional key skills module, which we term the PKS module. It's still very similar today. It might be slightly different names and things like that, but it's very similar in its ethos. And there are different learning outcomes that we had in our PKS module. Some of them are shown here, so things like communication skills, welfare ethics, legislation, all of that kind of different things. Again, if you've actually done the Cert AVP, you'll know that it's not a taught course, so very much the people that are involved are learning with themselves and with peers. So you're researching lots of essays, you're writing essays on all the different topics that meet the learning outcomes for the module, and you're using discussion forums with your peers. And the essays that you write are reflective, and this is a major part of the Cert AVP. So they use typically a reflective cycle. An example of that would be Gibbs's reflective cycle. So you're writing about something that happened, how you're beginning to analyse that through thinking about it really in depth, what you're sort of seeing as went well, not so well, how you're analysing what you're going to do in the future, and so on. So the participants of the Cert AVP were writing 9 essays within their PKS module and then one final summative piece. And this final piece was roughly something like 1,500 words. And it really brought together the learning throughout that module and how they're seeing their behaviour change based on the PKS module. But what we're really wondering is, what is the impact of this reflective type of CPD and this non-technical skills-based CPD? So a first piece of research that Stephen and myself did looked at these summary essays, and we did identify that there were a variety of different benefits of having done the PKS module as part of the Cert AVP, and they were for the different stakeholders, whether it's yourself as the vet, your practice, the patient and the owners, and here's just a small summary of some of the results from that paper. One of the really interesting things that came out of it was that some of the participants were describing how they've improved the meaning of professionalism in their mind, and this had led to reduction in stress for themselves. And that's not necessarily something we were expecting or looking for, so we thought that was really interesting, and what we decided to do was a second study, which I'm going to summarise in this presentation. The second study looked at how does completing this module improve any emotional wellbeing of the veterinary surgeons. And so to do that, we used an approach of identifying negative to positive emotional changes within these summary essays. And we looked at the context around that emotional change. So we had all 120 potential participants. So these were people who had written a PKS summary essay, but who hadn't taken part in our previous research. And we emailed them, and then we sent them some reminders, and these emails came from me, so I introduced myself as an educational researcher who hadn't been involved with the Cert AVP, and they also were signed off by Stephen May, who was a module leader, which gave it some authenticity as well for them. And when someone agreed to participate, they gave consent, and we collated their essays via a third party so that we didn't know who had written the essay. They were completely anonymised before they came to Stephen and myself. And what we also importantly asked them to do at this point when they gave us their consent was to say that these were still their genuine views. So we were fully aware that they were writing these things to pass an exam. So it may well be that not everything was truthful, so we made sure that they were saying, yes, these are our truthful views, so that we repurposed these exam answers for actual research. So how we actually did it was we looked at, as I said, a change between a negative to a positive feeling or emotion. So we created a list of negative and positive emotional terms from the literature, and some of this involved these nice emotional wheels that you can see, they're quite pretty. And we also started reading some of the essays, and if new words were coming up, we included them in our list of negative and positive feelings. And we had a third sort of shorter contextual list, which was things like, so I can feel surprised, but that could be a very bad or very good thing. So we had some contextual ones as well. So once we'd identified this negative to positive feeling, we looked at the context. So that could be a few sentences or a paragraph or a page. It could be anything that was related to that negative to positive change. And we looked at sort of what they were talking about and any outcomes in terms of benefits for which stakeholders. So we basically used a sort of a mini Brown and Clark thematic analysis really on these sections of the essays. So this was conducted by myself, but with repeated discussions with Stephen for the veterinary perspective and to make sure that face validity was really there. So I've got an example, small summary from one of the essays that just shows you this negative and positive changes in emotion terms. So I'll just let you take a minute to read it. I think it's quite a poignant one. I hope you can all see that from that. So obviously the red are our negative phrases and the greens are positive phrases, and the number at the end is our participant identifier. So that's just an example of what we were looking at. So in the end we had 46 participants say that yes, we could analyse their essays, and from those essays we identified more than over 70 specific examples of this negative to positive emotion change. That's quite nice really. I mean, we weren't asking them to write about that necessarily in their essays, so it was good that we had all these examples. And then we developed 3 themes that were related to the sort of the context of what they were talking about. So I'll go through these just quickly now. So the first theme related to the actual PKS module itself, and the negative views relating to this were things like reluctance, trepidation, scepticism. They weren't particularly happy about doing this PKS module. At the start, they really perceived the topics to be irrelevant by and large, and they found the nature of the module very challenging, and this largely came down to the idea of reflection and essay writing, especially mixed together. But what they found was through actually researching and writing these essays that there was this surprising relevance of all of these different topics, and that then subsequently increased their motivation to really want to keep going with this module. And when they started to develop confidence and skills, this also related to reflection as well as the things that they were learning about. And so there were benefits for them. Some of them talked about being a better vet, as well as all of the other stakeholders that we identified in our first research. And so those negative feelings became things like enjoyment and hope. So I have a few examples of quotes for you, and what I'll do is I'll show you the sort of the negative and positive wording, and I'll just read you the quote. So the first participant said, "Initially I was sceptical about the value and relevance of the subjects. As I progressed through the module essays, I discovered new areas of knowledge and interest I was unaware of. I found that the essay titles I found most difficult were also the ones I found most stimulating. Perhaps my trepidation had been due to ignorance in these subject areas." A second participant said, "I feel the most major personal development I've made during this module is learning how to reflect. I found it a frustrating process initially, but once practiced, I found it a useful tool when analysing my handling of different clinical situations, and from this analysis, what direction I need to take to be able to improve my skills." And the final example is a nice outcome from this theme. So one participant said, "Before this module, I mostly felt like a vet when doing clinical work. But with a more solid non-clinical base, I also feel like a vet outside clinical practice in how I communicate, reason, interact with people, research and learn, and conduct myself as a professional." So the second theme related specifically to the non-technical competencies that they felt like they were improving. So they had some frustration and unease with some of these different types of skills. But through learning about them, through reading, through researching, through writing those essays, they were able to really develop their skills and then go and practice them in the workplace. And they found there was benefits for them, again, in terms of things like enjoying work and the other stakeholders. So the more confident, positive feelings were things like confidence and feeling valued. Unsurprisingly, the what they talked about in terms of the non-technical competencies strongly related back to the outcomes of the module, so that's really great. They were actually picking up on the outcomes that we wanted, so that's fantastic. And just a short example here, so a participant said, surgical complications are not rare and can cause a lot of frustration to clients and surgeons. Keeping detailed records for every surgery performed became a necessity, and involvement of all staff members in these procedures strengthened our team spirit. And the third theme, which is probably the most relevant for today's session, really was this stress and coping through a reflective focus. So the negative emotions here related to things like guilt and struggling and stress and anxiety. And what they realised through researching and writing these essays was that, yes, vets can face stress and that practices can foster multiple different types of stresses. And this could be, as we've heard all about today, in terms of workload, in terms of poor management, including failure to maintain your ideals, all of these different things, and they could understand that from the literature. And what they started to do was a process of changing things, including this idea of cognitive reframing. So they changed their view of themselves in terms of what they actually do, so that could include expectations upon themselves, and what they actually feel, so it's not just me that's going through this. And they also did the same for the cognitive view of the organisation as well. And what they found was that there was this benefit for them in terms of reducing stress again, and the same stakeholders would benefit, including this time nicely friends and family was another one that was brought in. So the negative views became more like enlightenment, harmony and happiness. So some examples from this theme. So one participant said, long hours in themselves are not necessarily stressful, so long as we feel valued and supported. I feel more confident about deciding what I'm capable of and comfortable doing and ensuring I do not overcommit to others and fail to take care of myself. Another said, I, like most people, have some feelings of inadequacy. However, I've noticed improvement since beginning my CERT AVP. I was surprised to recognise some of my traits in the description of imposter syndrome, which is a very high correlation with stress and anxiety. This has made me think more about taking a small amount of pride in my achievements rather than dismissing them. And finally, reading around the subject of vets' burdens has legitimised my struggles and I feel less alone. I've learned to respect my time off and not feel guilty for needing it. I've developed a group of friends and we have a mutual understanding if our phones are on at night, we can call each other to discuss challenging cases. I feel more of a member of a profession than ever previously. This also includes that first quote that I let you read about understanding what you can and cannot possibly change within the practice. So to bring it together, our participants had an increasing realisation of this relevance of these non-technical competencies that they'd understood through taking part in the CPD. And a lot of this was down to being able to use reflection to understand what they were thinking and going through. They ended up changing things that they did and the way that they felt. And this can be known as cognitive reappraisal or positive reframing, and that's really the process of cognitively transforming a situation so as to alter its emotional impact. So as we said, there were some organisational changes, some things that people started doing. If they were really overloaded, they really thought about the distribution of labour and made use of their interprofessional teamwork. They used new support networks that they just created completely after having taken part in the CERT AVP. And they started to recognise the stresses and understand what you can and what you cannot change. And some personal changes. These involved two different ways of looking at this. The calming of the negative critical voice, potentially along the lines of we're all humans, we may make mistakes, it's the way we deal with them that's incredibly important. And also this positive appreciative inquiry, having some pride in the work, as we've said and heard in earlier talks, really remembering what good things have happened. So you may consider that there could be some claims that there are some limitations of this work. So it was a convenient sample of reflective summaries, which were part of this assessed programme. So as I said before, though, we made sure that these were still genuine views of our participants. We also did not have a positive biased sample that wanted to do this module. As you saw from the first theme, they didn't want to do this module, but they really did talk about how it's benefited them. And really, these essays provided such an amazing wealth of data that you wouldn't probably have been able to get through normal standard research means. So they were self-reports, so it's not an actual measure of behavioural change, so you could suggest that we could do some observational work, ethnographic work, for example, but we really thought actually it's also quite important to understand what they thought were the benefits, what they saw was the changes that they'd implemented. Now, we only specifically looked at a negative to a positive change, so we didn't focus in on negative staying negative or even positive going to negative. So that could be an area for future work if we were able to. But what we really wanted to highlight was the positive nature of going through the CERT AVP for our specific participants. However, of course, it wasn't all absolutely perfect. I'll show you one last quote that just is an example really of this sort of negative staying negative. I'll let you hopefully read that one. And I think that this one just highlights very much what we've been saying in the last two talks, really. There's probably only so much one person can do. We really need the organisation as a whole, the profession as a whole, to be making the changes as well. However, you can make differences just yourself. So in conclusion, we do think that future thoughts and changes to CPD should really incorporate these non-technical competencies as far as possible, and maybe we can do a bit more continuing to research what actually we want the CPD to be about, so that we're ensuring we have this a profession with good wellbeing that's actually supporting and providing the needs of society that they need as well. So I'd like to really thank all the participants who allowed us to use their essays. Obviously without them we couldn't have done it. Thank you all for listening, and happy to take any questions.